In this video, I share how I explain type 1, type 2, and prediabetes to others in an easy to understand way, basically in 20 minutes or less. I review diagnostic lab numbers like fasting blood glucose, A1C. I cover the 4 key elements that must be addressed to successfully manage diabetes and keep blood glucose levels in safe range, otherwise known as my diabetic table. So, you've been told you have diabetes by your healthcare provider and have been sent to learn a bit about diabetes and what to do about it. Or you need to explain this to others who have diabetes. Let's dive into what diabetes is and why you have been told that you have it. There are 2 main types of diabetes. Type 1 diabetes, usually developed as a child, sometimes called juvenile diabetes. It's autoimmune in nature, meaning the pancreas basically stops making insulin because the body turns on it, destroys the beta cells that produce insulin. So you immediately require insulin or shortly thereafter diagnosed. Type 2 diabetes is gradual onset, often diagnosed with prediabetes first, which I'll get into later, but it's a result of insulin resistance or ample insulin being produced, sometimes more than enough, but the insulin's not able to do its job and let sugar go where it needs to go. Insulin is like a key that unlocks cells, allowing glucose to enter, and this just isn't happening. Often, like I said, overproducing insulin in the beginning, leading to further progression of type 2 diabetes, islet cell burnout, and the need for insulin later on in diabetes. Prediabetes, or the early warning sign, is when blood sugar levels are slightly elevated above the normal range and can lead to progression to type 2 diabetes. So it is definitely a warning sign. How does the doctor know that I have diabetes, or in this case, yourself? Well, let's look at your labs and how diabetes is diagnosed. Fasting blood glucose, which is greater than or equal to 7 millimoles per liter, and I'll put the US equivalent here as well, or an A1C greater than or equal to 6.5% in adults, or a 2-hour post 75 gram oral glucose tolerance test that's greater than or equal to 11.1 millimoles. Random blood sugar at any time of day that's equal to or greater than 11.1 millimoles. So what's prediabetes? Basically, it's a fasting blood glucose of 6.1 to 6.9 millimoles. It's a 2-hour post 5 gram load of 7.8 to 11.1 millimoles, or an A1C of 6 to 6.4%. So, your health practitioner has diagnosed you or someone you're trying to explain this to with diabetes. So let's jump into how to manage it. So there are 4 key elements to managing your diabetes, and all of these need to be balanced for optimal control of your diabetes and blood sugar. That's why I like to use the concept of a 4-legged table. If anyone's leg is out of balance, if you sit at a restaurant and the unbalanced leg, you got a Kleenex under it, it's annoying. Your water or your glass of beverage could fall off the table, and it's a sign that the table is imbalanced. It's wobbly, it's not effective. So if you see here, I draw a table. I like to use this concept to explain diabetes management because it's very visual, and I've used it hundreds of times explaining this to other people in practice. So I write blood sugar at the top. You can call it whatever you want. Trevor's diabetes table, my blood sugar glucose table, whatever. So the first leg of the table is food. And food, in my opinion, is the most important leg of the table. It has the most influence on blood sugar levels immediately. And what we choose to eat has, like I just said, an instant effect on blood sugar. And our goal with all diabetes is to keep blood sugars in safe range and as close to normal as possible. So what is your target range? Well, that depends on your medical team and yourself. Your age, there's many variables. So it tends to be very individual. But 4 to 7 pre-meal or fasting, 5 to 10 or 5 to 8 2 hours post-meal, and an A1C of 6.5% with type 2 diabetes and less than 7% with type 1 diabetes is typically the target. A1C target usually is adjusted with the elderly and people with hypoglycemic unawareness. So how do I know I'm in good range? Well, you have many things. You have continuous glucose monitors out there. That's what I use, a CGM. You have flash meters where you can scan your blood glucose levels. You have blood glucose meters, monitors like the old days, the finger prick method. And of course, lab work you get every 3 to 6 months, depending on the type of diabetes you have and where you're at with your diabetes, depending on your team. Now back to the first leg of the table. As you can see here, food has an immediate effect on blood sugar. So that's why I make it the first leg. As you can see, it raises blood sugar. That's the arrow on the table. So there's 3 macronutrients or food groups you need to be aware of. There's protein, there's carb, and there's fat. Protein, as you can see here, has minimal effect on blood sugar, but it does cause a delayed spike in blood sugars if you eat enough protein later on. fat has no effect, and carbohydrate has the biggest effect on blood sugar. So we'll come back to that in a few minutes. So you have GI index. And what a GI index basically is, a glycemic index is how fast food is converted into sugar in your bloodstream. So the lower the glycemic index, the lower it turns into sugar in the blood. And those are the foods you should try to choose most often. Fiber is another very important thing to consider when choosing foods. The higher the fiber, the lower glycemic index, or the lower the glycemic index or GI index. And that also slows down the absorption of sugar that enters the bloodstream. For anybody with diabetes who needs to keep that blood sugar lower and in range and doesn't have the ability in their own body to do that on its own, these are important things to consider when eating. So let's jump to the balanced plate and have a look at what happens when all three macronutrients are taken into consideration. So if I draw a plate here, as you can see, and I divide it into threes, I'm going to have protein and a little bit of fat up in the one side, and then I'm going to have some carbohydrate, and then some more fibrous free vegetables that fills up half the plate. Because if you do those methods and you sort of have a balanced plate approach, you're going to have a lower spike in your blood sugar. As you can see here, if I draw a graph and I label it on the left-hand side of the graph, the blood sugar, and at the bottom I label it time. So let's say we're eating breakfast. At the left-hand side of the graph, you have, I'll label it 4 to 7 to let's say target of 8, and then greater than 10. And on the bottom of the graph, I have the time. So let's say we're having breakfast, and we're going to choose, I'm going to use an example of not using the balanced plate approach, not considering the glycemic index and fiber when you're choosing a meal. So I'm having breakfast and I'm in a rush, and I grab a piece of toast and I basically just butter it with jam. You can see here the blood sugar goes way above my target range of 8, 2 hours post-meal at 10 o'clock in the morning, and then it actually keeps going higher. It goes way out of range for me personally as a type 1 diabetic, and then eventually it'll come down, sometimes too low because I've overshot, or it'll stay high. And then let's redraw this graph, and then same labels on the left and same labels at the bottom. We're going to have breakfast, but we're going to have a balanced breakfast this time. We're going to have toast, and we're going to put a little bit of butter, and maybe some avocado, and maybe a soft-boiled egg on top. That sounds actually delicious, in my opinion. So we do that, and let's see what happens to the graph. As you can see here, it doesn't go above 7. It stays nice and even, doesn't spike above target, and it comes right back down to where we want it in normal range. 4 hours after our meal, and 2 hours we're within under 7 target, and we're doing great. Let's move on to the second leg of the table, which is activity. And I say activity versus exercise because it's not necessary to hire a personal trainer or join a gym to get active and improve blood sugars. A simple walk can improve your diabetes. Well, why? Why is that? Well, activity literally pulls sugar out of your bloodstream to be used as fuel, literally. Activity treats the main cause of prediabetes and type 2 diabetes by making the muscles and cells less resistant to insulin, so the insulin produced can be used more efficiently and effectively. Some exercise, like high intensity training, or like CrossFit type stuff, or boxing, resistance training, deplete the body's sugar storage system so that the food consumed afterwards is not stored as fat, but actually restored as fuel to be used later. So as you can see here by the arrow down on the leg, it balances out the table and leads to better control. Basically lowers blood sugar overall. Leg number 3, which is medication. If you're a type 1 diabetic like myself, you'll be taking insulin immediately or shortly after diagnosis. If talking to a type 1, review the types of insulin. I often explain it. There's basal insulins, like the Tracebas and the Lantuses, that keep your sugar normal when you're not eating. And then there's the rapids, the regular insulins that are taken for food. There's also insulin pumps. If you're type 2 diabetic, you'll be on oral medication, but there's too many medications to go over because I'm trying to explain this in 15 minutes or less. But there's a ton of medications out there for diabetics that are type 2, including injectables. Eventually, with type 2 diabetes, if it's not controlled with lifestyle, you may end up on insulin later on. Some of the oral medications that you take type 2 diabetes will do a number of things. Some of them help your pancreas secrete insulin, The most important one that you take right away is usually insulin sensitizer like metformin, you've probably heard of it, that make your body less resistant to insulin, and it helps your insulin you do produce work better. So as you can see here by the arrow on the third leg of the table of medication, the obvious thing we want medication to do for diabetes, whether it's type 1 or type 2, is to keep your blood sugars in the home range or lower your blood sugar. So leg number 4, and in my opinion one of the most important legs of the diabetic table, is stress. Stress and stress management. Stress is very important to consider with diabetes management for a number of reasons. Stress causes increased levels of hormones such as cortisol that can increase insulin resistance, which is the primary root cause of type 2 diabetes, and increased blood sugar levels in general. Not a good thing with diabetes. So if a person is not managing their mental health, then all other aspects of diabetes management become less of a priority or an afterthought. So like being mindful, being active, getting good sleep, reaching out for support, having a healthy support network, having a team to help you with your diabetes, reducing or avoiding alcohol or drugs, as they tend to increase stress, anxiety, and depression. I mentioned sleep already, but I'm going to mention it again because sleep apnea can really increase cortisol levels if you're diagnosed, which can really compound and make your type 2 diabetes, prediabetes, all that more worse, because it causes more insulin resistance, more cortisol, blood sugars are higher, you got more insulin floating around, you're gaining more weight, because stress causes blood sugar to go up typically, if not managed and controlled. So if you flip the table on its side like a ladder, you can see that stress must be addressed and overcome in order to climb the ladder for success with your other areas of diabetes management. So there you go. When managing your diabetes, picture your diabetes blood sugar table in your mind's eye. Choose one leg at a time to set goals on, remembering though that all 4 legs have an impact on blood sugar. Thanks for watching, and check out my video here on stress and diabetes, and my other video here on the difference between type 1 and type 2 diabetes. Bye for now.